everybody, welcome to week 7. You have casual Tracy today because I am currently off from my full-time position, coming to you from my deck. It's a little cloudy right now. I'm hoping I'm not going to get rained out for this post. But week 7, curriculum design, program evaluation, program outcome evaluations. It's a huge topic. Lot of changes happening with curriculum that we'll be discussing. But one thing I do want to mention before we get into the content, I know quite a few of you are struggling right now with participation, and this is the hardest part of the course, the middle, where you've got your regular classwork, your practicum that you're trying to understand and participate in, work, family. It's really a lot right now. So I feel your pain. Do the best that you can. I need to grade things according to what you submit, but if you had to, this might be the time where you're not necessarily going to get an A in the course, but you really need to get a lot out of your practicum. Anyway, I just wanted to tell you I understand your circumstance. I certainly hope that all of you can participate to the fullest and get an A in the course, but the real purpose is to learn during the course, regardless of the grades. So anyway, I'm thinking about you and praying for you and hoping that you can keep it all together and juggle until the end of the course. All right, let's talk about this curriculum design and evaluating program outcomes. So evaluating program outcomes, we do that a lot in pre-licensure programs. What percentage of our students pass the NCLEX the first time? What percentage of our students are employed within the first 6 months as an RN? There's all sorts of different things. There's different exams that we take. Can our students communicate well? Can they write well? Can they critically think? There's a whole bunch of things like that. The problem is, as healthcare becomes more and more complex, what was happening in nursing education is we just get adding more and more content to the program. You'd go to a curriculum evaluation meeting and we would put up big, long, white sheets of paper all around the room, stuck up on the wall, and we'd have each class, and we'd list out the main content of each class, and we'd try to figure out how can we juggle it around, how can we fit in more, how can we have it flow and not be repetitive. And eventually, content overload was just overwhelming for the students and the instructors. And so one of the things that's happening in a lot of programs is concept-based curriculum. So in a regular pre-licensure curriculum, you'd have like foundations or fundamentals, Med-Surg 1, Med-Surg 2, OB, PEDS, maybe critical care. You'd have it organized that way. In a concept-based curriculum, you're dealing with concepts. How to care for a respiratory patient, how to be a professional, how to have an ethical practice. So let's say that maybe we're talking about how to take care of a respiratory patient. So you would have this whole discussion about taking care of any respiratory patient and all the things that are involved. Then you talk about respiratory problems in the neonate, in the child, the adolescent, the adult, the older adult, the senior citizen. You'd go across the spectrum. And then you'd have certain exemplar diseases that you talk about how to take care of a patient. Hi, sweetheart. My kitty cat is being a little loud. But you wouldn't discuss every single disease process there was in respiratory. But after the course, if that nurse, that student nurse, ever cared for a, had to pet her, ever cared for a respiratory patient, they would know the basics, regardless of if they had that diagnosis or not. So I'm attaching a few different things about evidence or about concept-based curriculum and about making curriculum changes. One is about getting evidence-based practice more in curriculum, and the other two are about concept-based curriculum. I'd like you to look them over. Concept-based curriculum is a huge undertaking for any nursing program because the whole nursing program gets reoriented. We end up doing a lot of team teaching because let's say my respiratory example. Well, you might have to have an OB nurse, a med-surg nurse, and a peds nurse teaching all different pieces of this respiratory component, because not every nurse on your faculty is going to be competent from, fetal through geriatrics. So it's quite interesting, but it is definitely a wave of the future and really focusing a lot more on critical thinking versus memorization. So it's interesting. I'd appreciate if you take a look at some of those pieces, and then we can talk more about traditional curriculum versus concept-based curriculum and the pros and cons of both. So, all right, I'll be adding more this week. I am tomorrow morning heading off to the Jersey Shore. I used to live in Pennsylvania, and I love the beach. So I can't wait to head back to the Jersey Shore. I will still be participating online tomorrow. Most of the day I will be in the plane, but definitely every day I'll be looking at the individual forum, questions to the instructor forum. So if you have questions, please post them. And then I'll be in the main forum throughout the week. All right, I'm looking for a discussion on this meaty topic, and I'll see you in the main forum.